This is the City of Ketchikan Mayor Bob Sievertson. Social distancing is an important way to help prevent the spread of COVID-19. Social distancing includes avoiding gatherings, staying 6 feet away from others whenever possible, staying home if you're sick, and avoiding handshakes, hugs, and other forms of casual social contact. Social distancing works and is important. Your actions matter now. Learn more about how to prevent the spread of COVID-19 at coronavirus.alaska.gov.
Good evening. This is Dr. Ann Zink, Chief Medical Officer for the state of Alaska. Today is April 1st, 2020. I'm providing a brief update on COVID-19. As of today, we have an additional 10 cases. 2 are from Anchorage, 3 from Fairbanks, 2 from North Pole, 1 from Juneau, 1 from Ketchikan, 1 from Wasilla, 3 male, 7 female, 1 between the ages of 19 and 29, 8 between the ages of 30 and 59, and 1 over the age of 60. None are considered travel-related cases, 2 are considered close contacts of known COVID patients, 8 remain under investigation. We'll continue to update people on the website, and there'll be changes to our website tomorrow, so it will look very different regarding the case count, so stay tuned for that. We'll also be providing more information about what's happening with the healthcare infrastructure, as well as what's happening to prepare for COVID-19, including modeling and predictions. I also just want to say thanks to everyone who's being tested, getting tested, and staying home and distancing. The WHO said today that if you were testing and you had greater than 10% of your tests were positive, you weren't doing enough testing. As of today, our test rate were positive 2.8%. So nice job, Alaska, and great job socially distancing. Make sure that you're washing those hands, staying away from any crowded place, at least 6 feet away. The more we learn about this disease, the more we really realize how incredibly transmissible it is. So make sure you're taking care of yourself, and we'll keep you informed. Thanks so much, and have a great night.
So how long does a person shed the virus if they become infected? Based on the currently available data, people typically start shedding at some point, either right around symptom onset or potentially even a little bit before symptom onset. And the peak time for viral shedding is within, 2 to 3, maybe 4 days after symptom onset. And then after that time, for most people, especially folks who have mild illness, the viral shedding starts to taper off. Some people who get more serious illness may continue shedding the virus for weeks.
Hello, my name is Autumn Padrone, and I'm a 15-year-old freshman from K-High. I'm going to talk to you today about psychological safety. Specifically, how to keep your kids from driving you crazy and how to keep them from getting cabin fever during this epidemic isolation. If you want to make sure teenagers are adhering to social distancing and home isolation, here are a few suggestions. First off, keep us well informed. We will find out, and it's better coming from you sooner rather than later. Second, we get that we may not be returning to school until September. So, if we are going to be doing online classes, give it to us now and use a format we are familiar with. We all have school computers. Let us use them. Third, give us something to do at home. We don't know what to do. Remember, we are home, and if we go crazy, so will you.
Another question that is coming up a lot is around treatment. What are the treatment options for COVID-19? Well, right now, the only treatment that is currently recommended is supportive care for COVID-19. Unfortunately, we don't have any antivirals that have been proven to be beneficial for COVID-19. There are a number of antiviral medications that are currently undergoing clinical trials to determine if they're effective against COVID-19, but none of these antivirals have yet been proven to be effective.
This is City of Ketchikan Mayor Bob Sievertson. When it comes to COVID-19, we need to flatten the curve. What does that mean? It means taking action now that keep the coronavirus from spreading so quickly that our healthcare systems become overwhelmed. What can you do to help? Don't shake hands. Make sure to cover your sneeze and cough. Wash your hands more frequently and for at least 20 seconds. And stay at home if you're sick. Together, we can flatten the curve in Alaska. Learn more about how to prevent the spread of COVID-19 at coronavirus.alaska.gov.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
So how long does a person shed the virus if they become infected? Based on the currently available data, people typically start shedding at some point, either right around symptom onset or potentially even a little bit before symptom onset. And the peak time for viral shedding is within, 2 to 3, maybe 4 days after symptom onset. And then after that time, for most people, especially folks who have mild illness, the viral shedding starts to taper off. Some people who get more serious illness may continue shedding the virus for weeks.
This is Pat Tully, Director of the Ketchikan Public Library and a member of the Emergency Operations Center. In an effort to slow the spread of COVID-19 in Ketchikan, 2 local beaches and several playgrounds have recently been closed. South Point Higgins Beach and Rotary or Buggies Beach have been closed because they are gathering places where people were not maintaining a 6-foot distance from one another. Playgrounds have been closed because slides, swings, and other equipment are difficult to keep sanitized and safe for children to use. The COVID-19 virus is easily transmitted in public spaces such as these, even when we're being careful. So please, let's hunker down and stay home. By doing this, we can slow the spread of COVID-19 and avoid overwhelming our healthcare system and get through this together.